Hi, my name is Jason Horrox. I'm a physical therapist with ATI Physical Therapy, located in Hatfield, Pennsylvania. Just wanted to put together this presentation to go over some common injuries. This one being shin splints in the female athlete. Um, so, Looking to help inform parents and young female athletes in middle school, high school, and college level. Just a little bit of information as you guys get busy into your seasons. Shin splints are medically diagnosed as medial tibial stress syndrome, or MTSS. That's what I'll see on the script after a patient has seen their doctor and they're referring them to physical therapy for shin splints. Um, Basically, shooting pains of the bone that run between the knee and the ankle. These can be on the inside portion of the shin or the outer portion. And basically, those pains create inflammation in the medial compartment of the lower leg, and it aggravates the surrounding skin and soft tissue. This is an anatomical illustration of what happens with the inflammation during shin splints. As you can see here, we have the large bone in the lower leg, the tibia, and then we have the fibula here, which is the smaller of the two. Basically, the muscles in through the tib and fib become inflamed uh, with improper um, ramping up periods during activity. And you can see here the whole area that you get the inflammation. So some common factors that cause shin splints, they tend to occur when exercise is ramped up too quickly. We definitely see it at the start of a athletic season, or during training camps. Um, Basically, the shin bone, the tibia, and the muscles and tendons supporting it are not accustomed to the stress. Again, that ramping up too fast and putting too much stress on the bones and tendons and ligaments and muscles in the lower leg there cause an increase in inflammation and pain, which tends to be very painful. Foot structure and muscle imbalances are another uh, contributing factor that we have to look at when considering shin splints. Um, when running, the force from the ground up through the ankles can kind of alter depending on the balances or imbalances of the ankle muscles. So think of your ankles as a shock absorber in a car, and if those shock absorbers are not doing their job, then you're going to get a lot of force up through the lower leg. Um, and then again, if one side of the ankle is stronger than the other, you're going to have an unequal force while hitting the ground. You can see this as wear patterns on the bottom of the shoes if one side is worn compared to the other. Again, it's important to make sure that all the muscles in the ankle are strong so that you're not wearing one side or the other. Some points to take into consideration when you're trying to prevent shin splints. Again, it comes down to slow progression of increased workload. Training regimens you want to slowly progress. Recommended 15% increase in activity per a week. So you can see why at the start of seasons and team activities, our athletes are tending to complain of shin splints compared to the end of the season. Um, Focus on strengthening leg muscles and core. Again, another big component that I've talked about earlier is muscle imbalances and making sure that all the muscles around the ankle and the lower leg are contributing. Now, if shin splints, are starting to become an issue, warm up and stretch. You can apply hot compress. You're going to want to make sure you're warming up that area and not just going straight into your activities. And then cool down and ice also help to um, improve blood flow and ice to decrease inflammation. You can see on the left there Just a good stretch with the guy at the stool there to stretch out the anterior portion of the lower leg there. That is a good stretch for preventing shin splints. And then on the left hand side, there's a therapist working to again stretch out that area with a patient. So shoes can be a whole topic in themselves as far as what to pick and what to use. Basically, you're going to want to try a couple of different brands, sizes, see what is most comfortable. The optimal weight, stiffness, and cushion depend on the athlete. Everybody has different arch heights. Some people have no arches, very flat foot. Again, the shoe that best fits your needs is going to be different from person to person. And then again, you want to take into the running frequency and the gait of the athlete when choosing those shoes. Something to consider is adequate support of shoes tends to run out 300 to 400 miles. So again, looking to replace old shoes will help to minimize the symptoms caused by poor footwear. So a lot of our athletes experience shin splints as part of the normal ramp up to prepare for their seasons. It's important to keep in mind that seeking out a doctor or a physical therapist should be done if these cases of shin splints are recurrent and do not improve. If the problem appears to be related to body alignment, again, the eye of a physical therapist would help to figure out what muscles are weak, what needs to be stretched, and how to best strengthen the athlete's ankles and lower legs so that they do not have as much pain while running. Also, people with flat feet, poorly aligned hips, those kind of goofy, altered running mechanics would benefit from seeking a physical therapist just to kind of work on those gait mechanics and make sure that all the muscles are firing properly. It's also important that if one leg hurts more significantly than the other and the pain is localized, there are cases where there's a stress fracture. So a lot of times if you do go see a medical doctor, a lot of times they are going to do an x-ray just to try and rule out any kind of stress fracture. Again, this is something you want to take in consideration when it's one leg that hurts more than the other and it's very tender in one spot. So if you get to the point that you want your young female athlete checked out by a physical therapist, we do offer complimentary screens for any injuries at ATI, specifically myself in Hatfield. Um, we have what's called direct access, so we can start up physical therapy for up to 30 days without a script from the doctor. So in a lot of cases, you can come right in, no wait, basically see same day if necessary, which is important with our athletes because I know that sometimes wait times to see a doctor can be, upwards of a month, and we're just starting up the season in a lot of these scenarios, so patients and athletes need to be seen. So feel free to reach out. I have the phone number there of the clinic and my email. So again, any questions that arise, always give me a call or shoot me an email. These are some of the references used for this PowerPoint slide.